I can hear you loudly and clearly. Oh, you have a great photo of Highway 1 that you gotta love Highway 1 if you live up here, this section, because I love those curves. So hang on, I'm just going to give us all right. Leanne has now gotten us on our YouTube channel, so you can watch this talk with our Chakrabarti on KGUA's YouTube channel. And it's nice to be able to share with him. And we discussed whether or not he would come in or stay in his office, because we're both fully vaccinated and we're both comfortable. But then we decided, well, we'll just be good stewards, good leaders, and we'll do it this way for a little bit longer just to be safe. Anyway, thank you, Leanne, for that. And I want to give a quick look at, oh, I don't want to change anything. Guess what? It's blue skies. It's nice. It's going to be windy again today. That's our weather today. And let's just get started, Aura. Aura Chakrabarti, many of you know, is the CEO or ED, I think it's both, of RCMS, Redwood Coast Medical Services. He came in as a pinch hitter or designated hitter at the time when RCMS was just in desperate need, and he has helped with the support of you, the community out there, to bring RCMS back into a healthy place. And it's a little over a year now, I believe, Ara. And then, he had to make some tough decisions. Some people he had to let go. I don't know how many of those people have come back on board. But the RCMS, as we know now, is in a much better position. It still will always need our help and support. But particularly, we're going to talk a bit about, of course, COVID and the wonderful effect that RCMS has had on our community. But before we go there, and I asked Ara if it was okay if we could talk about where he comes from and what's going on with COVID over there. And by that, I'm talking about the continent, the whole India. I'm talking about India. I'm talking about another part of the world and how COVID is affecting that. And last week, we gave a big shout out and send a lot of prayers to everybody in India. And Ara, I know that you have family there. And so I just wanted to get some insight on what's happening in India from someone who would know, and you're in healthcare.
Thank you. My brother is a physician there, so I do get to talk to him from time to time. The situation is pretty horrible over there right now. And the way it evolved, and again, this is from 10,000 miles away and talking to people and reading about it, is India had a very low case numbers in January, February, March. And I think that gave them a false sense of security that, COVID is over. And then this second wave came. And what had happened is during those time when the case numbers were really low, there were a number of things that could have been done was not done. One was the government didn't spend the time and effort to build the infrastructure that is needed to deliver the vaccines or produce the vaccines to the extent it needed to be, and just have the basic infrastructure ready. Because the anticipation was always there'll be a second wave will be coming, but how severe it is probably was underestimated. So there was mismanagement, there was probably all kinds of infrastructure, service delivery related issues that was not addressed. The second thing was that there was a false sense of security. People stopped wearing masks and start getting in gathering togethers, and wedding parties started again, and et cetera, and people were not just interested in doing all the restrictions. So that was a big mistake, And thirdly, I think there was a lack of interest in getting vaccination. At the time when vaccines were available, people are not lining up. So all those things combining, and then of course the second wave came much stronger than anybody had anticipated. The whole system collapsed. There was no
Mm.
way to handle this many people getting sick and needed hospitalizations or medical care when the infrastructure was not prepared to do it. It's somewhat similar to what we had in this country in the first wave when it came in New York City. New York City was just couldn't handle it, and this is a country, hundreds of times bigger than New York City, and the whole country is in a same situation as New York City was. So that's why it's many people are dying, and it is a horrible situation.
When you say the infrastructure needs were not met, what do you mean by that? Could you explain that a little bit more?
So the starting from the vaccine production. So India is the largest producer of vaccine, but instead of distributing it within the country, they started exporting it. Now, of course, there's some real reason for that. There are some other countries in Africa and other places, they just didn't have any vaccines. So India was working with the United Nations to send vaccines. It is the largest producer of vaccines. But what was not thought through that, there could be a second wave. So we should have some stock in the country, in the hospitals, and, wherever the distribution centers are. So that was not thought through. Secondly, the delivery system, who gives the vaccines, where the vaccines are given, is it only the city hospitals or it is across the country? All those things was not thought through. And all the other infrastructure related issues, that if the need comes, how do you deliver it? They still needs to be kept in appropriate, refrigeration and etc. You have to move it from the place of manufacture to where it will be given. All those things were not clearly thought through. No plan was in place that you can quickly execute. So basic infrastructure to deliver vaccine, produce and deliver vaccine, was not clearly thought through.
Wow, there is a cautionary tale there for everyone as we're all moving into whatever this next phase is. And there are still concerns, here. Are we unmasking too quickly? I understand San Francisco and Marin County will be moving to the next tier, which I think everything can be unmasked. But as you talk, I realize that we have such mixed images about India. We have the images of, well, of course, the great historical images, but of a lot of medicines. I know a lot of people have gone to India for surgeries. And yes, we think about the production of medications, in this case, vaccinations. They're not talked about as much as China or some of the other countries, and the help that the nation is giving to other nations with the vaccines. They have an incredible amount of amazing writers and, literati. It's a nation that is so huge that we just have these little images, and of parties. It seems like you guys love to party. All of these festivals, and of course weddings, and all of that, and so many people. So we don't really know what it means to be living in India now, other than the huge amount of people. And I think that this is really a cautionary tale for us, because we're all feeling so happy to be unmasked as you and I are sitting here, although not together, and the ability to hug each other again, as some people are doing. And yet there's still people that need to be vaccinated right in our own country.
Right. Maybe it's a good segue that we can talk a little bit about the vaccinations and
Yes.
where we are in the community vis-a-vis RCMS, what we're doing. So let me start with that. We have given about 6,500 doses of vaccine in the community so far through RCMS. About 3,000 people, slightly more than 3,000 our community members are fully vaccinated with 2 doses. And we have another few hundred that got 1 dose. Now what we're seeing, I don't know if it's a reluctance to get vaccinated or there is not enough people left to be vaccinated, maybe a combination of all of those. That well, these vaccine clinics that we are setting up, it takes us effort and time and resources. We're not getting as many people coming in. So I think this is an opportunity to talk to your listeners and remind them that if you haven't been vaccinated, now it is opened up to age 16 and up. And in all likely scenario, by in next few days, we'll probably have 12 and up, vaccine-ready population. Anybody 12 and up will be able to get vaccination. But right now, it is 16 and up. If you haven't been vaccinated, you should be. And the way the process is still is go through RCMS website and sign up through that SurveyMonkey system we have, and sign up, giving your information, and we'll call you. We still have about 800 people who haven't been vaccinated. That is still in our list, not even the short one. But when we call them, we're not getting the response. We're not able to contact them. We're not able to get them in. So please do get vaccinated. Let me just give you couple of perspectives here. Why you should be vaccinated. It is to protect yourself, your family, and your social context. Because if you're not vaccinated, you could be infecting somebody who may be much more vulnerable than you. We also need to have more people vaccinated to create this quote unquote herd immunity in our community. We need to have 70 to 80% of the people vaccinated so that we all can benefit from that. And then the last thing is that, if you're not vaccinated, you will be still wearing masks. Like, Peggy and I are fully vaccinated, so we can take our mask off and we can actually meet now. So if you're thinking of getting back to the life before the COVID-19 situation, like you like to travel, you like to meet others and have all those activities, go out and eat at the restaurants, get vaccinated. That's the ticket to get those things done. So bottom line is that, at least in our assumptions, we still feel there's a number of people in the community should be vaccinated, but we're not able to contact them, or when we're contacting them, we are not able to get them in. So please make an effort. If you want to lose the mask, get the vax.
That's
I think
yeah.
so that was one thing. Number two, I would say that we did hear over the last few days, as we started telling people that we will cut back on our vaccine clinics because we're not getting enough response or enough demand. Some people have commented that, well, we have signed up and we never got the call. So this is my opportunity to communicate and tell them through your radio station, Peggy, that if you signed up on SurveyMonkey and you didn't get a call, so there could be 2 reasons. One is that we may have genuinely made a mistake and your name got misplaced or something. The other possibility, it's a more likely scenario, is that when you filled out your information, you gave an email address or contact information that is probably not accurate. People make mistakes in providing email address. Maybe the ID was not exactly the way it is. So if we send an email to that address, you'll never get it. So if you signed up and you didn't get a call, then call our front desk. That's only if you already signed up and you're in the age group of 16 and above, that you didn't get a call our front desk and they will figure out what went wrong and get you lined up to get vaccinated.
And what is that number to your front desk?
Yeah, the front desk number is 707-884-4005. I think that's the
Mm-hmm.
number.
And
Yeah.
then push number 6, I believe.
I mean, just call that number and then talk to somebody in the front desk and say that you have signed up, you have not got called. Can they look into it? And they'll
Okay.
take it from there. Now, if you have not signed up and you're still waiting for whatever reason, then don't call the front desk. Go to our website and the Survey Monkey, where we capture all the information, fill that out, do that survey, and that will automatically generate information to us to contact you. So don't call the front desk if you have not filled out the survey. Now, if you do not have the access to the website, or you have situations that you cannot fill it out for whatever the reasons are, absolutely feel free to call us and we'll help you. So yeah, if you haven't filled out the survey, go fill it out. And if you have filled out and haven't got called, then call us. There's something not quite right. That's what, we'll address it. But at the end of the day, we need more people to get vaccinated in our community. We have some 7,000 to 8,000 people or 7,000 to 9,000 people in the community. And even if you consider that a good 5,000 people are vaccine able, we have only vaccinated a little over 3,000 people so far. So we still have quite a bit, to go, and to get to that 70% or 80% herd immunity, we need more people to be vaccinated. It just helps all of us. It helps you. It helps the rest of us. We can start opening up. Our businesses can start opening up. Our restaurants can start opening up. We can again meet and do the things that we could do before. So yeah, please do.
Good message, strong message, and it is so important. I didn't realize that our numbers were, we aren't even at 50% vaccinated at this point, maybe close to it, but not really. I can't quite tell,
Right. I mean,
and that's only certain age group.
Correct. The only thing that I would say that there's some people who may have got vaccinated from somewhere else, not through RCMS, and we don't have that information. But the assumption here is that many of us are not vaccinated. There's a vaccine hesitancy is there. I think it is unfortunate that there's so many other stories going around, that someone is putting a chip on your shoulder when you get vaccinated and all that. I mean, I think this area, the community is much more knowledgeable, educated, that those are only hearsay. I mean, this vaccine is safe, and all 3 vaccines are very safe. 200 million people have got vaccinated in the country. And let's get all of us vaccinated.
200 million, that doesn't sound like enough people. I know that the first group of people to reach herd immunity are the Navajo Nation. And they're spread out all over the place. The Navajos, a lot more younger Navajos live in cities and that things, but traditionally Navajo people like to live about 60 miles apart. And their neighbors are the Zunis, who live in the original apartment buildings. They live one right next to each other and on top of each other. It's quite a contrast between those two communities. But they're the first people that have gotten the so-called herd immunity in this country. And we definitely need more of that. We haven't been talking about that term much, herd immunity. It was talked about a lot in the earlier months of COVID. And so we do need to have that here. I think this whole vaccine hesitancy and what's come down to, I mean, yes, there are the people who listen to those wild rumors, but I think then there are people also that I know of who are intelligent people, but are concerned because they might have they're concerned about some physical reaction.
Yeah.
to it. They might have some, I don't want to say disease, but something within their own body that they're worried about getting a reaction to. I don't, and I do know some people who just have really serious internal issues that I don't know if they'll ever be able to be vaxxed, but if the rest of us get vaxxed and wear masks, at least we can make it through this. And I'm very concerned about all of the openings that are going on. And New York City is possibly going to reopen. I mean, you think of that amount of people, and yes, people are traveling. I want to take a road trip. I want to, do other things as well. So I like your term. If you want to lose the mask, get the vax.
Yeah.
I don't think you can say it any better. So when is your next clinic?
Well, just let me just make one correction here. I think I misspoke there. Not 200 people got vaccinated so far. 200 doses of vaccines have been administered in the country. Doesn't mean that 200 million people got vaccinated. 200 million doses have been administered. So, right. So because if we do get 200 million people fully vaccinated, we made huge progress. So that was one correction. 200 million vaccines have been administered in the country. The second thing, that just your point, that is some people have reactions and have underlying conditions that might prevent them from taking vaccine. The best way to address that is to talk to their providers. Their individual medical provider will be able to give them the appropriate guidance that whether they should be vaccinated or not and when, etc. So use them. And if your provider is a RCMS provider, and if you haven't got the vaccine yet, call them up, set up an appointment, and or discuss with them that when you should get vaccinated, why you should get vaccinated. They are providing those kind of guidance every day to our patients here.
If you just joined us, I'm talking with Ara Chakrabarti, who is the executive director of RCMS, Redwood Coast Medical Services, who have done a stellar job, I think, in how they have organized and gotten people vaccinated. But we're at a point, not just here on the coast, but a point in terms of, I would say, I'll just stick with our nation, United States, of reaching a point where some people are hesitant. And there are various reasons for that. And as you say, some people have underlying conditions that they're concerned about, but we still need to get vaccinated. This is still a dangerous disease, new to humans. And then there are those variants. I've been concerned about those. What do you know about the variants?
Well, I mean, while people are getting sick, and then again, I'm talking about the medical providers and clinicians, what they're telling us is that if more people get sick with this virus, then there'll be more variants will be developing. The example in India is maybe something to be thinking about. They had very low cases for 3 months, January, February, March, all 3 months, very low cases. But because there were so few people are getting vaccinated at that time, more people started getting ill, and this variant started, and they're calling it double variants or whatever in India now. And now that took over the whole country. So that's we can look at that and say that, yes, if we stop getting vaccinated, if more of us are could get this virus, then more variants will be developing. If the virus has less place to go and less people to infect, there will be less variants developing. At least that's what the scientific and the clinical community is telling us. So the only way to stop this is to get more people immune to this by getting vaccination.
Well, and the worst case scenario is, of course, if not enough people are continuing to get vaccinated, then there's going to probably be a rise in deaths. And sadly, we see that far too often, whether it's among our own families or families. I don't know of many families that haven't been touched by a COVID death at this point. And so we want to avoid that, and getting vaccinated is one of the ways that we hope we can control it. What are they telling you, these scientists and other specialists, about if the best case scenario and everybody gets vaccinated as soon as possible, when might we start seeing a slowdown in people getting ill and dying?
Well, I think that the scientific community is saying that, as soon as majority of the people are vaccinated, or whatever that percentage that needs to be, 80% or so, things will start opening up. I mean, then it will evolve into more of a virus that we have other viruses, flu virus and others. So yes, it is probably not going to go away. But it is not going to be this, this devastating and this kind of, this stopping the whole country from doing anything. So it's probably going to be there. We might, we don't know. There are some discussions that is going on in the scientific community that is an annual booster shot is needed, etc. We have to wait for the scientific and the CDC and the clinical community guide us on that. But it is true that more people get vaccinated will be inching more closer towards getting back to some level of normality of a life that is kind of, stopped for the last year plus now.
Okay, well, I don't remember your answer. When is your next clinic?
We do have a clinic this Saturday, 8th. And, again, it is by invitation, but if you're not invited and if you need to be vaccinated, please contact us. We'll put you into the list. So that's what right now the plan is, that we want to take an assessment of the situation after this clinic on 8th, because right now we have more supplies than demand. We are holding on to vaccines, and we can only hold on to vaccines for so long before it must be administered. So after this clinic on 8th, we'll take an assessment of what the situation is in the community, how many people still not vaccinated, and we'll make a decision, the follow-on clinics.
And what time does the clinic start and end?
What was that? Sorry.
What time?
I believe I think it's 9 o'clock, or normally
usually 9 to noon or something.
Yeah, 9
like
to
that.
noon is normally that, and it's the same location, the firehouse. And so right now the situation is we have more vaccines in our hand than people are willing to come, and we are a little concerned that we don't want these vaccines to go wasted.
No, we don't. And is this, does it matter, this clinic on Saturday, is it for first time or first and second time?
I think it's all first and second time. We're still kind of going through the list we have. The about 800 or so people haven't been vaccinated yet in that list that we have, plus number of people who are due their second dose. So we're calling all of them. But if you are not being called and you are in the community and you signed up, just call us. And if you haven't signed up and you need to be vaccinated, please go sign up right away so that we can include you in this vaccine clinic.
Great. Well, I have noticed that there were not the lineups I've seen. I had to drop something off over the weekend here at the office, and I saw that there was a clinic and not very many people. I have to say, though, to people who have not gotten their vaccine and have been, still quarantining in place, it's really fun to go to the clinic. It's very well organized, and it's one of those times, if you haven't been getting out and socializing, this is an opportunity. It becomes a wonderful event because you see other people that you haven't seen for a while often, and the people, not only the people from RCMS and all the other volunteers to show up. It's so well organized that there's so much more than just the thought of, oh, I'm going to go and get a needle in my arm. It's actually a wonderful event and helps you understand what kind of future you can have, we can all have, of being together again. It's just, it becomes almost a party. And of course, you have to sit there after you get your vaccine for 15 or 20 minutes. So you're sitting around with a bunch of neighbors and friends that you haven't seen in a while. So, it's actually been a fun thing to do. And knowing that you're also protecting yourself and other people. And I think that can't be overstated enough, though, the part about you're also protecting vulnerable people from you, because no one wants to be the cause of getting anybody else sick. Well, Aura, what else do we need to talk about today?
Well, I mean, we can talk a little bit about, this overall RCMS related topics besides
Mhm.
vaccination, although that is kind of the main point of discussions in many ways. But the clinic is doing well in the sense that
Great.
from the perspective of where we were about a year and a half back, not only financially, we are in a lot more stable ground. That's with the help of the community, we have been able to achieve that. And the team members played a key role in turning things around. They all stepped up, did things. We, as you said at the beginning, that we had to cut back on staff to get our financial house in order. We have gone back and hired quite a few new employees over the last number of months as we are getting more stable financially, and so we can fill those holes that we had. So the team did continue to do great work. There is still a lot of work has to be done to continue to build the morale of the team. We continue to do things in a small pieces. It was not their fault, the situation that we got into, but they were part of solving it, and they suffer some of the consequences. So we continue to work on that. We are putting together a longer term game plan for RCMS. And the community will hear a little bit more over the next, number of months as we start putting this, I would call it more of a strategic plan for RCMS.
Oh,
So
that's good.
one perspective that is clear in everybody's mind, or most people's mind, I would say, that an entity like RCMS is absolutely necessary for this community to be the community we are. Healthcare need is one of the basic, most fundamental need for all of us. And RCMS is the front door for that very basic fundamental need we all have. There is no other option here, right? I mean, we could drive 2.5 hours to go and see another provider or another medical facility, but that's not the realistic solution for the community we have. 30 miles north of Gualala and 30 miles south of Gualala, that about 50, 60 miles on the coast, and some area in the interior. RCMS is the only game in town for providing medical care. So it is important to realize that RCMS, or a derivative of RCMS, has to be here longer term for this community to be the community we are. And if that assumption is correct, then we need to put together a longer term strategic plan for RCMS, that RCMS will continue to evolve, remain part of the community as the community is evolving. RCMS needs to do things differently as the medical service delivery in the country changes, the provider changes. So all those things needs to be comprehended into a longer term game plan. And that's one of the area that the RCMS staff, the board, the community, hopefully will be involved in working together, putting together a 10, 15, 20 years strategic plan for RCMS.
And now that just raises a thousand questions for me. Maybe not a thousand, but so many. I love the idea of a 20-year plan. And I also am curious, have you been following the Biden administration's plans? He's really looking at rural, and which is a very nice thing to see. I mean, we're seeing broadband education help and trying to fill in the gaps where we've lost so many jobs right now. But looking toward the future of rural health care, do you see some place like RCMS getting benefit from this current administration?
Absolutely. And I think we want to piggyback that wave of investment that the federal government is making, and we want to take advantage of that. Well, one thing I would suggest to your listeners, and of course I'm biased because I'm part of RCMS, but I would say that the uniqueness of RCMS, given that we are 2 hours, 2.5 hours away from a higher level care facility, that we have done very successfully some of the public health work in this vaccination situation, or even the testing prior to this, during the COVID-19. We did the work where most of this work was done by public health organizations because there was no one else to do it. So given all that, I think we have an opportunity to evolve RCMS into one of those poster child of healthcare providing facility for rural America. Why can't we be that? We are doing some of our urgent care, the trauma center, quote unquote, that we have is unique, right? We are the fourth one in the state, and others are connected to hospital or inside a Air Force base or something like that. So those specific things that's so unique to us, and we have done such a good work with the help of the community and the volunteers' involvement in delivering some of these vaccines and testing, and the opportunity we have to take into consideration the investment the federal government is making currently for rural healthcare. Why can't we build something that can continue to provide healthcare at the highest level possible to this community for a much longer term, and become one of those successful stories that how rural healthcare service delivery can support a 10,000 people community and still meet their basic fundamental need. You don't have to live in a big hospital, town or a city to get at least the front end of medical health care. And that's the goal of RCMS. I think that should be the goal of the community too.
Wow, I'm so happy to hear all of this, and particularly knowing how reluctantly you put your toe in the water here, and now the whole body, the whole man is there, brain, everything is going. So let me ask you a couple of basic questions. One, infrastructure. Obviously, the building, the facilities are old. And being able to build something new, and I know former directors wanted that as well. That's a very expensive venture, and yet to be able to do that and build more state-of-the-art facilities in the future, it sounds great. Is that part of the plan?
Yes, that is one of the critical element of this longer term game plan is the facilities plan. You're absolutely right. It is understood and accepted by everybody that the current main building that we have is not conducive to future of tomorrow, RCMS of tomorrow. That tomorrow is not
Mm-hmm.
2 years down the line, but 5 years down the line. It's impossible. It is dysfunctional at best, and we cannot renovate this. So we have to have the new facility or significant improvement in the current facility. That is a very expensive proposition. And part of this longer term plan, that is one of the principal focus at how we gather the requirements, what we need to have from a facility perspective. How do we get the approvals from the Coastal Commission and the county to do something like that? And then where the funding comes from. We are looking at all those elements. And there is a team that has been put together, a core team, that is working through that process, that we're looking at the original previous plan that was put together. Obviously, that didn't go far, so we're trying to analyze what went wrong there. Maybe it was too big, maybe it was, whatever. So we're putting all that stuff together, including, we understand one a big element of this is that we have to have appropriate funding, to make that happen. So this is my hope that, this time when we started, I will not start an activity unless I have some sense of getting it done. We will not have another false start. That is the way I'm looking at it. But it is also the fact that we must do something. This current facility is not going to be able to provide the service that is needed in the community, 5 years down the line. So we have to have some. Now we have some time. We have a runway, 3 to 5 years to work through that. While we're doing that, we might make some minor modifications in the current building so we can continue to provide that. But that's, it's a centerpiece of our long-term game plan.
Well, all of that sounds wonderful. I want to now direct some attention in a different way, and that is some of the response from some of the other elements in the community that feel left out, and I'm talking particularly about the Poem communities and the Latinx communities that don't feel. Now, this is just anecdotal. I don't have, these are just people who said, I don't feel comfortable going to RCMS. I haven't been treated well at RCMS in the past. How will those needs be looked at and taken care of?
Well, I think it's a very valid question. And there is no quick fix to some of this. This is a little bit of various elements. I think our communication to those communities, underserved communities, the Latinx communities, the so-called I would not use the word the poorer, but the people who doesn't have the ability to come to us, have difficulty having transportation, etc. Reach out to those communities is one of the major items that we should continue to focus on and work on. So that's one area I think we must do a better job, and we are trying to continue to figure out what is the right way to how to approach them and how best we can serve them. So that's one. Number two is that particularly the Hispanic, the Latinx community, we did make some change. We did hire a provider who is very fluent in Spanish. One of the things that we have heard is that people who come here who does not speak, the only language they speak is Spanish, there is not enough support here. We don't have providers or support staff who can always translate and understand that. So we did hire someone. We did have a new provider joined us in January of this year. She's fluent in Spanish. And one of the plan that we have, longer term plan, is that she will start building a clientele, a patient list that who are Hispanic speakers or from the Latinx community that she can communicate, they can trust, etc. When you say that people don't get treated well, there are many reasons, and I'm sure that there's some of those we have to continue to work on. But a major part of that sometimes communication. If the language is a barrier, then it becomes very difficult. So we're trying to address it. So I think community reach out is one. We will do better job, or at least we're trying to do better job having providers and support staff who can speak the language so we can make people feel comfortable. And I think maybe the third element is that we would need help and guidance from the community members of those groups telling us how best we can reach out to them, how best we can connect with them, what we need to do. We are making these initiatives. I would request those community members, the leaders of those communities, come and tell us and give us some ideas and guidance. And we are all very much willing to listen to and act on it.
I know you guys are all very, and thank you for those, by the way, thank you for those assurances. And I know you're all very busy. I think sometimes asking for community members to come to you, how, if you, and future thought, finding a way to go to those communities. And now the Latinx is a little different than the Native community, because the Native communities have buildings where they could meet, perhaps, and it would take more than one, because it takes a while to build up that momentum. But knowing that they were important enough that you would come to their house, so to speak, might be something to think about and just plant that seed in the future. And I'm sure with the Latinx community, there are other ways to do it. So I'm going to ask another question. What about collaborations? Is RCMS, MHA, and Coastal Seniors, for example, are you guys collaborating together?
Yeah, I think I'll address it, that question in two ways. One is that our collaboration here locally with other entities like MHA and Senior Center and others who are in general in the healthcare related or providing healthcare related support to the community. So yes, that we will continue to work. There are various initiatives we are working with MHA, and they are very helpful. And sometimes we get, we step on each other's toes, but that's okay. That's we are working together. CLST, another great example. The relationship with our ambulance folks is, it has evolved. I mean, I can say that 15 months or a year and a half back when I first started, that relationship and where we are now, we work hand in glove so many ways. We are training their EMTs, they're working out in our urgent care. We have some game plan associated with that, so we can continue to build the skill set of their EMTs. It's only goodness for the community. They're helping us to reach out to homeless community for vaccinations. They're giving us an ambulance. They're going to there during all the vaccination clinics, the CLST team members and the firefighters. I mean, they're all together. They're the one who's driving it, and we are kind of overseeing it. So I think those relationships are important, and we'll continue to build upon that. So that's one element. The other element I think is important to me is relationship with higher level care entities, such as hospitals, whether it's Adventist Hospital or St. Joe's in Santa Rosa. We need to really rebuild those relationships. In fact, we had the president of Adventist come and visit us once. I just know him a little bit from before because he was the CFO there. So, I think we had some conversations, but he came and visited us. And this week, again, the three of their providers are coming and visiting us, and we're trying to establish a stronger relationship with the hospital there for referral purposes. I mean, as I always say this, that RCMS is the front door for all your healthcare need. Not everything is provided here, but once you come in, we figured it out what needs to be done, And we have those relationships with the higher care providers, specialists and hospitals, that we can coordinate that. And in that relationship is also very important. So yes, we are trying to build on that. And I'm sure we'll have stronger relationship with Adventist Hospital as well as hospitals in Santa Rosa area as we go forward.
It's all good news, Ara. I mean, I know this is all hard work. Nothing getting all of these lines of communication established, but that's a good plans that going forward. I can only see positive things coming out of all of these relationships, and they do take time to build, but working toward them as you're improving, of course, your own facilities and staff there to provide more. But all of these things are so important. I mean, RCMS has to be a cornerstone of the community, and going forward, it sounds wonderful. I know we have MHA coming in tomorrow talking about some of their plans, because they do other things for health that they're not really in your purview. They can't be. You can't do everything. How is the new board working out?
The new board?
Mm-hmm. Your board.
Yeah. The board is it's an active board, which is appreciated, and they all bring in unique qualifications and perspectives. We have physicians on the board who bring in a physician perspective. We have people who has come out from financial background, fundraising background, who are helping us. And I think the board is also now reflective of the community, geographic. So location wise, we have board members from Timber Cove to all the way Point Arena and up north. So it's a good board. It's a board that reflects the desire and the needs of the community. It's cooperative board. It's willing to work and help. And my sense is that the board is also listening to the community. It's not that they're just deciding what needs to be done. So I'm happy with it's an effective board, and appreciate their involvement and their guidance. And so yeah, I think they're doing well.
And since we're reaching an era of potential unmasking, might there come a time in the next few months when there will be an in-person board meeting with the community as opposed to the virtual ones?
I would hope so. I think, not only the board meeting, in-person board meeting, but some of these town halls that I do, it'll be so much better if we do it in front of people. I would love to go to Manchester and do it there, and in Timber Cove, and in Gualala and Sea Ranch, etc. So we can see the people face to face. I would say that we all want that to happen quicker than later. So let's get vaccinated so we can make it happen sooner.
That it always comes back to that. Or we just have about 3 minutes left. And I think you just summed it up, though. It's all about right now continuing on with the vaccination. I really thank you and appreciate your time for this, catching up on primarily about COVID and the vaccinations, but allowing me to ask you those questions about where you're going, and if you're looking at and hearing some of these community concerns and how you will be facing them. And it makes me very happy to hear that you're, as you say, you're not going to start something that you can't finish. So that gives us a lot of hope with your leadership and with the board and with the staff. So, as I say, we got about 2.5 minutes. What would you like to conclude with?
So I would say, this is an opportunity for me to, get in front of your listeners and share information. But I also want to thank the community. This is an opportunity for me to thank everybody. The volunteers that helping us in the clinics, the vaccination clinics, the donations that the community gives us, so we can continue to do the things that we are chartered to do. And this is also an opportunity to tell you that our staff members, our team members, you must be very proud of them. They are absolutely the greatest. They take the risk every day so we can be healthy. They are the front line. And I've seen during this period of time that they stepped up. They care about
Mhm.
this community. And I think I mentioned to you once before, I don't see them as employees here. They are not, because their family members, their friends, their neighbor come to them to get the most basic fundamental need, which is healthcare. So they don't see themselves as employees of RCMS. They see something bigger than that. And I cannot say how grateful I am, and the community should be, that what a fantastic group of employees we have here. And thank you, Peggy, giving us this opportunity. I know that you have some fundraising activity coming up
Mm.
3 weeks down the line. I just want to put in a plug for you here, that your station and your ability to attract the local people, it give all of us a voice to share our views that is important to the community. So good luck with your fundraising activities, and anything I can do to help in that, I'll be the first one to raise my hand. So thank you for giving us the opportunity.
And you raise your hand and open your wallet. That's another key. I'm sorry. Fundraising. Aura, thank you so much. And I really appreciate that. We're both in two parts of the same purpose, having a healthy community, building a healthy community, and serving a happy and healthy community. And that's what we do. We don't do it because it's what me or my volunteer staff want. We want to create a healthy community here where we all live in beauty. Thank you, Aura. This will
Thank you.
repeat later, and it'll also be on our YouTube channel. So thank you so much. Always good. You guys have a great day over there at RCMS.
Thank you very much.
All right. We're going to say goodbye to Aura for now. And